Hi, it's MDNetX. Today we're going to talk about healthcare patient referral leakage and patient retention. So why should we care about leakage? Leakage basically means that we're losing patients from a healthcare system or practice. The first and foremost problem with this is lost revenue. There's a downstream effect from this. Patients that are lost may never come back to a system, which could lead to a ripple effect. A patient that doesn't get a radiology referral may not get an oncology referral, may not see a surgeon in the same system, and so forth. Not to mention that the patient may also not bring their family, which can also propagate the effect. This has become very important for sustainable healthcare systems and ACOs. ACOs heavily depend on the concept of retaining patients within a geographic area and a system to make the reimbursement model effective. We can talk about referral leakage, define it as the patient and or referral that is lost to an outside health system. Basically, a patient sees a provider in your backyard, but the patient doesn't come to your practice. Why does this happen? There are several reasons. One of the most common is insurance coverage. You're not in a provider network, and therefore the patient doesn't want to pay a higher out-of-pocket expense. So logic dictates they go to someone else who's in network. Provider specific. Providers oftentimes dictate where patients go, and they sometimes have personal preferences about who a patient sees. Sometimes there's no reason for this. Other times there are pre-established relationships. A provider knows someone very well and wants the patient to see this provider. The reasons go on and on. Poor patient retention. This is a common problem where patients have difficulty getting in to get an appointment, lots of the logistical issues. The reason isn't clear to the patient, for example, why they need this referral, why do they need this test. It's still very much a paper process, and in many cases the patient never gets the referral done. So they never see the specialist, they never see the radiologist, and the referral never happens. And geography plays an important role. Oftentimes we also see that patients move out of a certain geographic area and then they are out of that system altogether. So we define leakage mathematically as basically referrals to you or your practice divided by total referrals from that person minus 1. So this is basically looking at as someone sending you patients, how many are they sending to your practice, your specialty, and then what are they sending to everyone else? So what are you capturing out of that provider's referrals? So many people say, well, I really know this well. Many providers insist they know the referral networks like the back of their hand. There's a pretty well-known quote from Donald Rumsfeld, and he talks about there are known knowns. There are things we know, so we know the providers that definitely refer to us because we see their names all the time. We also know there are known unknowns. We kind of know that there are some providers out there that we're not really sure what's going on with them. And then there are basically things we don't know. So the unknown unknowns, we have no idea, we don't know them. And this example I give is basically we know that providers are sending patients to us, but how do we know that they're sending all their patients or some of their patients? So the ideal practice would be this little red dot in the center. The blue dots around the red dot represent referrers, physicians that are referring patients to your practice. In an ideal world, basically everyone would send all their patients to your practice and no one else. And you'd see this is a very closely clustered and tightly knit group, and you're getting everything you're in this area getting all the referrals. In reality, and this is the reality, you do have typically a cluster of providers that will provide you the majority of your patients, but then you have a scattering of providers that are outliers. Some of these providers are closer, not that close by, maybe on the fringe of your geographic market. There's a litany of things going on here, but the point being is that you have a significant number of providers that are not in that inner ring, which you want them to be. And then to add to the picture, you're typically a practice of many practices overlapping with other practices in an ecosystem. So in many cases, there may be opportunities where there is overlap and there is no overlap. And this is difficult to know because you have to really know what's going on in the outside practices to have an idea of what their referral patterns are. So referral data, where does it come from? Unfortunately, there is no magic referral data set. Referrals are still mostly a paper process and therefore difficult to capture. And in systems where they do have electronic referrals, those are typically not publicly available. The way that most firms approach this problem is by using claims data. Claims data doesn't necessarily always have detailed information about the referrer, though. So teaming data sets are used. And what's mean by that is that when a patient shares two providers within a short period of time, there's some assumption of a referral that has occurred there. So if a patient sees a family medicine doctor and then a radiologist within maybe a 20-day span, the assumption is that that patient was referred from the family doctor to the radiologist. There has to be some other logic applied because, for example, if the patient sees another doctor after the radiologist is obviously not the one referring that patient to the other doctor. In that case, the patient is probably going back for follow-up. So there's some nuance to this, but it gives you a good idea of where the flow of the patients are in a system. So let's take a look at how this works. So this is an actual physician group and their referral network. In the center is the actual practice, which is receiving all the referrals, and outside all these dots represent actual physicians and their referrals to that group. At the bottom, we see here a scale, which is labeled leakage. So leakage of 0 means that essentially that physician or that provider is sending all of their patients to the practice in the center. They aren't sending any of those patients to a different radiology practice. The color scale here represents how big that referrer is, so how many patients they have. So you can see here the upper scale 882, at the bottom end of the scale it's basically nothing. And you can see here we have a couple large big fish in this group that have quite a few patients, and then we have referrers here who have very few patients. As we move through the leakage scale, we can see there's a significant variation and distribution of leakage throughout the network. So in this network, there are approximately 1,200 providers. And you can see that there are a core group of providers that leak none of their patients and send all their patients to the practice, but there are quite a few providers that are sending a significant number to outside practices. And this is key. So we have what we think is a sweet spot where you have providers that are between 50 to 90%. So these providers send you a near majority of their patients, but for some reason they're losing some of these patients to other providers. And identifying these providers is extremely important because this is something that you can fix oftentimes with a simple phone call. So an example we can give here is that one of these providers was explaining to the group that they had difficulty scheduling their patients, and that's why not all the patients were coming to that practice. So the key point here is identifying those outliers and finding who do you need to talk to, and addressing underlying problems. And many of these are simple structural problems. None of this ends up being rocket science, but it's extremely effective because it allows you to focus on the providers that aren't at the highest level in terms of the referrals to your practice. So if you want to know more about this, please feel free to send us an email. We have data on almost all practices in the US, and we can give you some idea of what we know. Hope you found this interesting and hope to hear from you soon. Thank you.